Good morning, everyone. I'm Donna Metter. I'm president of the Kentucky Nurses Association Board of Directors. We're so glad you could be with us today as we come together for Nurses Month and Nurse Suicide Prevention Month. We thank Governor Beshear for making Nurse Suicide Prevention Month a priority, and we look forward to him joining us for the proclamation signing in a few moments. Today's event kicks off a month-long focus on suicide prevention, awareness, and the mental health of Kentucky nurses. The Kentucky Nurses Association is the only organization that speaks for and is responsible to the 90,000 nurses in Kentucky. Because nurses are the most trusted profession in the world, it is our responsibility to address the difficult issues. The issue of mental health and suicide is a challenging subject, but cannot and should not be ignored. There's too much at stake. Please visit our website at kentucky-nurses.org for a vast array of educational opportunities and activities around these topics. As we look to the future of nursing in Kentucky, I challenge all fellow nurses to employ their expertise in case management and objective practice to fairly and accurately assess the stress that they are under, especially this year. What we've been through and continue to experience as a Commonwealth, a nation, and world as we can combat the COVID pandemic pales in comparison to anything we could have ever imagined. At the center of this public health crisis stand nurses, always willing to help others and go the distance for patients and families, while often not thinking of themselves and their own self-care. While I could tell you more about this, I'd like to turn the program over to Dr. Janie Heath, the president of the Kentucky Nurses Action Coalition Board of Directors. Dr. Heath is also dean of the University of Kentucky College of Nursing. Welcome, Dr. Heath.
Thank you, Donna. And thanks to everyone for joining us today. It has indeed been a year that none of us will ever forget. This is especially true for Kentucky nurses who have never failed to show up to answer the call for help. They continue to work long hours as their day jobs, and then often they are found volunteering their off time to keep Kentuckians getting them tested and vaccinated for COVID-19. This type of commitment comes at a high price that can affect nurses' mental health and put them at high risk for substance use disorders, depression, anxiety, and even suicide. Consider the facts that have recently been reported in JAMA, the Journal of American Medical Association issue of psychiatry. Nurses and physicians face many similar risk factors for suicide. But in today's environment, nurses also face those risk factors that are potentially exacerbated by long hours, and they have less autonomy. And female nurses are roughly twice as likely to commit suicide than the general female population, and 70% more likely than female physicians. There are over 4 million nurses working in the United States, making it the country's largest healthcare workforce, 85% of whom are women. Nurses are human too and experience the same worries and anxieties as all Americans. Pre-COVID-19, the prevalence of nurse suicide was higher than the United States general population. And now, with compassion fatigue escalating, and the urgency is greater for evidence-based interventions, so another life is not lost to suicide. Leaders of the Kentucky Nurses Action Coalition have been actively engaged to address the silence of nurse suicide, leveraging the recently passed KNA and Kentucky Nurses Deans and Directors Resolution, a call to action for Kentucky nurse leaders to promote practices for optimal resilience and suicide prevention in schools of nursing. That is just one of the multiple other venues we have been working on to unfold and break the silence that we have with nurse suicide. We are so grateful that today the Commonwealth is officially taking a stand to prevent nurse suicide. If we save one life, the journey is worth it. It is now my pleasure to turn this morning's program over to the Honorable Governor Andy Beshear.
Al, thank you so much. And it's a pleasure to be speaking with such an incredible group of healthcare heroes, because that's what each and every one of you are. As everyone stated this morning, this is a year that none of us could have ever imagined. Certainly becoming governor 3 months before it, I didn't imagine it. The COVID-19 pandemic required you, as nurses, to see and to do the unimaginable. You went above and beyond your duty to serve. Oftentimes, you not only cared for individuals, but you served as the friend, the family, or the loved ones during times of isolation. You held the iPad up so that family members could say goodbye. You held hands as people passed out of this world to make sure that they were not alone, and you worried about taking this virus home to your families. I remember the days of sitting in my office, oftentimes on my personal cell phone, chasing down the 80th tip on PPE that had come in, knowing that it probably wouldn't turn out, but if it did, it would be the difference for you to be a little more protected when you went into work. So I cannot imagine the weight you've had to carry. And yet, you've answered the call. Every day you've managed to wake up, and every day to go into work to battle this challenge of our times. And outside your day jobs, you're volunteering to help test our people to curb the spread of the virus. You're also fueling our efforts to administer the safe and effective vaccines to our people. And let me say hallelujah. To have effective vaccines, and as of today, to have over 1.83 million Kentuckians vaccinated. Now, 80% of our population over 65 having at least one shot is nothing short of a miracle. And you all are a big part of how that miracle has happened. So y'all are a huge reason that we see a light at the end of the tunnel. So on behalf of the entire Commonwealth, myself, my family, thank you. You were, and you still are, here for our people. And you're such a critical part of Team Kentucky. And just like you've taken care of us, we need to take care of you. Your work requires a commitment that can take a toll on your mental health. As stated, nurses are suffering from depression and anxiety. Some of those struggles, heartbreakingly, result in suicide. I know your organizations are working to address this urgent issue, knowing that every life lost is irreplaceable, absolutely irreplaceable. To help give voice to those nurses struggling, you are here so that no one suffers in silence. This administration has worked to help create more resources for Kentuckians going through difficult times or living with mental illness. In 2020, we announced a $2 million grant to the Cabinet for Health and Family Services to treat Kentuckians, such as healthcare professionals like nurses, suffering from mental health and substance use disorders as a result of this pandemic. We also announced a $4 million grant to enhance outpatient treatment services. These are a few steps, though they're not enough, in what has to be a long-standing goal to create more resources to help those in need. Mental health is and will remain a priority, and I'm proud that I was able to sign a bill into state law taking part of the Affordable Care Act that we truly have to treat mental health like physical health here in Kentucky. That was a big day. And I'm proud to take another step in reducing the stigma and raising awareness of mental health issues among our nursing community here in the Commonwealth. Today, with nurses from across our state who work tirelessly to protect our people, I will proudly proclaim May 2021 as Kentucky Nurse Suicide Prevention Month. So, if I can read the proclamation. Whereas nurses are the largest group of healthcare providers in the United States and in the Commonwealth, where they number over 88,000. And whereas the American Nurses Association declares a healthy nurse, healthy nation social movement for action, knowing that nurses report higher levels of stress than the general public. And whereas 8 in 10 nurses say their mental health has been affected by COVID-19, causing extreme levels of burnout and psychological trauma. And whereas suicide rates among nurses are higher than suicide rates for the general population in the United States. And whereas 2021 is being celebrated as the year of the nurse and midwife, and the Commonwealth of Kentucky recognizes the contributions made by nurses and supports their mental health and resiliency. Now, therefore, I, Andy Beshear, Governor of the Commonwealth of Kentucky, do hereby proudly proclaim May 2021 as National Nurse Suicide Prevention Month, done here at the Capitol in the city of Frankfort today by me. I'm really proud to sign this because y'all are nothing short of incredible. And I can't thank you enough for everything you've done the past 14 months. And I want to be there for you every day I sit in this chair. All right, so we are now official. Once again, this is a grateful Commonwealth. I don't claim to understand the stress that y'all have been under, but I understand a little bit of stress that comes along with this pandemic. We will continue to fight to do the right things to keep you and everybody else safe. You know, I've said we'll get through this. We'll get through this together. I was talking to y'all the whole time. So thank you so much for everything you do.
Thank you, Governor. Hello, everyone. I'm Delano Manson, Chief Executive Officer for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. I know most of you all. On behalf of all Kentucky nurses, we thank Governor Beshear for signing this proclamation. By our presence today and the activities we have planned for this month, the Kentucky Nurses Association is making a commitment to provide nurses with the type of care that they give so selflessly to others. As the voice of all Kentucky nurses, we will remain vigilant in our support of these dedicated professionals who daily improve the quality of life for all the residents of our state. Thank you all this morning for being with us. Again, we want to remind you to visit our website at kentucky-nurses.org and to follow us on social media to learn about more of the activities and education that we are offering this month. And as always, take the time to thank a Kentucky nurse. You know, lots of them. I know most of the people on this program this morning, and I want to say thank you to each and every one of you for everything that you've done and you continue to do for families, patients, and all of Kentuckians. Thank you. And that ends our conference, our press conference for today. Donna, did you have anything that you wanted to say?
Thank you. Just ditto everything you just said, and thank you to all of you for being here today, for being with us, and for making this important issue aware, making our community aware of this important issue.
You guys have a great day and a great month.
That's right. And year of the nurse.